So student, we are going to learn about the bones of lower limb under your skeletal system. So previously we have learned about the bones of upper limb, right? So now we will start about the bones of lower limb. So the general arrangement of the lower limb, this is known as the surface anatomy. Okay. So lower limb is divided into four regions: gluteal region, thigh, leg, and foot. So here you can see in the picture, this is your gluteal region. You have learned already about in the muscular system, right? This is your thigh and leg, this and foot. So in together we are no we can tell as a lower limb. So when you go to the osteology, that means the bone arrangement of the lower limb, you can find the hip bone. Okay, this is your hip bone, femur, patella. This simply you can say as a knee joint, tibia, fibula. Okay, and tarsal, metatarsal, and the phalanges. These three bones are your coming under your foot bone. Okay, so together we can say in total, 31 bones are coming under your lower limb. So this is the bone forming pelvis. The two hip bones are joined anteriorly at the pubic symphysis and articulate posteriorly with the sacrum at the sacroiliac joints to form the pelvic girdle. So this is known as pelvic girdle. Okay, so it consists of two hip bones. These two hip bones join togetherly with the lower end of the spinal cord. This is your sacrum and this is your coccyx. Okay, and these two bone is your femur. So all together it is forming your pelvic girdle. Okay, we are going to see in details about this. So this is your hip bone. So what is hip bone? It is a large, irregularly shaped bone, each of which developed from the fusion of three bones, ilium, ischium, and the pubis. All three part coverage at the acetabulum. Okay. So here this is the pictures of the hip bone. Okay. So it consists of three parts: ilium, ischium and the pubis. So in pictures you can see this brown color. Okay, brown color, it is known as ilium. Purple color, it is known as ischium, and this part is your pubic. Okay, so coming to the ilium. Okay, this upper border of the ilium, it is known as iliac crest. Okay, and this broad surface of the ilium, it is known as ala or wings of the ilium. Okay, so here in the ilium, you can find some coming out parts, this protruded area, which is known as iliac spine. It has two parts again, anterior and the superior and the inferior. Okay, superior means upper, inferior means lower. So anterior superior iliac spine, that is the front view. Okay, anterior superior iliac spine. In the opposite manner you can find posterior superior iliac spine. Okay, then again you can find this protruded area, anterior inferior iliac spine. That means the lower part, but it is a front view. In the opposite manner, in the same manner you can find posterior inferior iliac spine. So this is about the ilium. Okay, now coming to the ischium, that is the purple color part of the hip bone, it is known as ischium. Okay, so here you can find this is ischial body. Here also you can find one protruded area which is known as ischial spine. Okay, this rough area, it is known as ischial tuberosity. Okay, and very importantly, you can find between the ischial spine and the posterior inferior spine, you can find one curve-like structure which is known as greater sciatic nodes. Okay, so this is about your ischium. Coming to the pubic bone. Okay, this is the body of the pubic. Okay, So this part is known as rammas, inferior rammas of the pubic. Okay, this is ischial rammas. Okay, this hole is known as obturator foramina, and importantly, this cup-like structure is known as acetabulum, which is joined with femur to form the hip joint. So here in this cup-like structure, the head of the femur will fuse, okay, to form the hip joint. So this is about your hip bone. So this there are two hip bone in a human. So togetherly they form the pelvic girdle. The most important difference between male and female pelvis is the pubic arch and the suprapubic angle. Okay, so now what is pubic arch? This is the male pelvis and this is the female pelvis. You can see the male pelvis is a little bit congested, okay, and the female pelvis is little bit wide, okay. So this is the main difference between the male and female pelvis. Now coming to the point pubic arch and suprapubic angle. Have you seen this curve-like structure? Okay, this is known as pubic arch. That means these two hip bone they join in this symphysis pubis area and they form this curve-like structure. This is known as pubic arch. And whatever the angle they make, it is known as subpubic angle. So in the below pictures you can see in case of male pelvis, the suprapubic angle is little bit narrow, that means the congested, which is lesser than the 70-degree angle. And in case of female pelvis, you can see that this is a little bit wide. Okay, this is more than the 80-degree angle. So this is the main difference between the male and female pelvis. Now coming to the bones of the lower limb. Okay, here mainly the femur. It is also called the thigh bone. It is the longest and strongest bone of the skeleton. It contains two extremities and a shaft. We'll see in details. So this is the anterior view of the femur. Okay. So it is the largest and the strongest bone of our body. Okay. Proximally we have the head of femur. This is your head. Okay. Head of femur. Here you can find one depressed area. Okay, this is known as fovea. Okay, the next you can find the snake. This snake it connects to the head to the shaft body of the femur. Okay, this part is snake and it has a two trochanter, greater trochanter and the lesser trochanter. This two part. Okay, and in between the greater and the lesser here you can find one line which is known as introcentric line. Okay, or you can say intertrochanteric line. Okay, you can find in between the greater and the lesser trochanteric view. This is the distal view, that means the lower area of the femur. Here you can find this abductor tubercle. Okay, this is little bit coming out there and you can find two part which is known as medial epicondyle and the lateral epicondyle. These two parts is co-joined with your tibia and fibula. Okay, and you can find one smooth area which is known as patellar surface. This patellar surface here you can find the patellar region, the patellar bone, the knee joint. It is found here. This surface is very much smooth. Okay, so this is about your distal view of femur. So in this video we have learned the anterior view of femur. In the next video we'll learn about the remaining part.